good?
You don't know where he is. So,
All right, we got about 2 minutes.
okay. Any last questions before we begin?
When did
The answer to your question is yes. As they come in Spanish, note them. Mark and Sergio note what the questions are in Spanish, and then when we go to the Q&A, pardon?
Where do we see the questions?
They're going to be, yeah, we're going to take notes, and Mitchell will share them with you. Okay?
Yeah, I'm looking at him right now.
All right. Is everybody ready to roll?
Walt, were you able to put that food list up?
Pardon?
The resources for food, that list?
Yes, I do have that. I do have that.
Okay.
I think that's going to be on there. Even though it's a long list, but.
Yeah.
Okay. All right.
Hey, Mark.
Is it actually on there? All right. Hello, everyone. City of Annapolis. We are live with amazing array of panelists, including our illustrious mayor, Gavin Buckley. What we're doing is having a conversation, the first of many to come, that is focused on communities and the impact of COVID-19 on communities. This gives us an opportunity to really focus our energy on how to best meet the needs of our residents, but also to hear from our residents. So as we proceed through this hour, we want to focus a lot of our attention on answering the questions and tracking the questions and concerns that residents have. I do want to note as we begin just some housekeeping that we encourage you to both ask questions as we go along and make comments. We also ask those who have language barriers and who are monolingual and bilingual, we encourage you to type your comments in Spanish and, if possible, in English. I do want to remind you that there are more coming, and we will focus a lot more energy based on the information that we get today on serving populations of our community who may not have access to information as we've mentioned. So to kick this off, I'd like to start off with the mayor of the city of Annapolis, Gavin Buckley.
Hello, welcome everybody. First of all, I would like to thank you for keeping this kind of distance that we're showing here. Thank you for all washing your hands. Thank you for doing this, because it all helps us get to the other side of what is probably one of the most biblical events really in our lives. We never thought that we would be sitting here today at home, for many of us, solely in our offices, experiencing not only a pandemic, but also an economic crisis. And so when the governor made a decision and the right decision that he made to close businesses down, we were not only tasked with managing how we were going to get the city through the coronavirus, but also how we were going to help our citizens survive the devastating blow that's happened to the economy. I'd like to go through a few slides just to sort of show you some information of where we are today. If you could pop those slides up for me, that would be great. So the bottom number, the 279 number, that was where we are week ending March 14th. The week ending March 21, the governor made the announcement that we would close restaurants, bars, gymnasiums, a lot of the kind of businesses that really are the backbone of the city of Annapolis as a city that is tourist oriented. The next number, 8981, is the number after the government made the demand that we stay at home. The right decision again, but obviously more and more people were needing to reach out and get on unemployment. This is the latest number, 10,573. We've never seen these kind of numbers. These obviously are administered by Anne Arundel County, but it's definitely something that no one was prepared for and that we have to plan on how we get to the other side of. If I go to the next slide. So we realize one of the main things, when you don't have money, when you don't have a job, and you have to feed your family, it was a highest priority for this city to get things in place to help the people that need it the most. Some of us are lucky to have a little more resources than others, but obviously when these catastrophes happen, our marginalized communities are hit the hardest. These are just some of the resources that you can go to. You can call the city's hotline to get directed to other resources. And I know some of our panelists will be talking about those later in the program. So let's go to the next slide. So this is how many COVID cases we have in Maryland to date. And this is a curve we would like to show you. So 6,185 cases. Can we go to the next slide, please? The blue line down the lower section is Anne Arundel County. Howard County is the one above that. Prince George and Montgomery, Prince George is the highest line. And this is what we talk about when we talk about trying to flatten the curve. Now, as you see, we started out on the same level, roughly the same level as Howard County, but we are above them now by a considerable number, really. So we need to learn from that county what they're doing that we're not doing, and we definitely don't want to do what Prince George is doing. So we are working towards flattening this. Your actions as a community are really, really helping us. But there are other things that we need to do that I'd like to talk to later in the program that I think we have to demand of our federal politicians and our state politicians. We go to the next slide. So we were not getting this information by zip code. We were trying to localize the number of cases in the city of Annapolis. So the best that we could do, and this information wasn't even being given to the county until recently, the county and the city started to put pressure so we could at least break it out by zip codes. Now, Annapolis zip codes go outside of Annapolis. The 410, the 403, the 402, they are out. Some of those zip codes are out of the city. So this isn't a true number for the city of Annapolis, but if you look at the data, you'll see that there are a higher number in the city of Annapolis according to these zip codes, but there also is a higher population that we have to be aware of. We could go to the next code. And the next thing which we're trying to break it down in is what communities were being affected by this the most. So we're looking for ethnicity in this so that we could know where to best put the resources, the most resources in the city. As you can see, it is disproportionately affecting the African American community. That has to be addressed. Without this information, you don't know where you need to focus your energy on the most. So we've only just got these numbers through and they're still being refined. But obviously we have an issue that we have to deal with here as a community, and that is what we will do. Next slide, please. So I can tell you that the city of Annapolis has been prepared for this and has been preparing for this a long time. Nearly 70% of the city's budget goes to first responders and associated costs. So fire, police, emergency management, the mayor's office, public works, the guys that are in the streets, picking the trash up, fixing the water main breaks, making sure that we have clean water to wash your hands. They have been on the job and they are turning up for work at an amazing rate. And I'm so proud of the city workers and what they're doing for this crisis. So I've got more to say on that. I just want to just give a shout out to what the city's doing. You can go to the city's website and go on the homepage. You can click straight on the COVID-19 section. There are a lot of resources there. There are the numbers that are on the screen as well. And I will pass it over now to Alderman Gay.
Can you hear me? Are you able to hear me?
Yes.
Okay, perfect. So yeah, I just wanted to follow up kind of on what Gavin was saying. Definitely referencing the African American communities and the numbers that we are able to look at today. Based off of what the governor sent out, we make up 37% of the patients in the state of Maryland who are affected with coronavirus and 44% of the deaths. And it's so critical that we, get the education out on social distancing and on wearing the mask, especially in our African American communities, where we're seeing that it's not that you are being that we get infected more. It's just that the underlying issues make it difficult once you are infected to survive the virus. So just continuing to spread that education throughout the communities and working with some of our property management and staff across the city to get that out there. In communities like Bay Ridge Gardens, the property managers are actually supplying material so that they can make the face masks and hand them out in the communities so that our residents are prepared. We're scheduling meetings with HACA to start communicating with those properties, putting signage up, just talking about what's taking place and what's going on in our communities, as well as shutting down some of the public areas where people are frequenting so that we just can continue to be in front of the curve and try to decrease the interaction amongst the communities and the gatherings. So we're definitely trying to be aggressive in that front and just continue to get the education out and let everyone know how serious this is. Especially again, like I said, with the underlying conditions and one of the serious ones being respiratory issues. And as we know, that's been something that's been talked about with some of the housing conditions. So it's important that we take this serious. Are we doing questions now or afterwards?
We're going to do them following.
Okay, fine.
Okay. So next up, thank you much, Alderman Gay. Next, we will have Alderman Mark Rodriguez. Mark?
Your microphone.
Mark, the microphone is still muted. There we go. Let me start again. Thank you.
We're all learning it.
So thanks everyone for joining today. Thank you everyone who's watching and tuning in. My name is Alderman Mark Rodriguez, and I'm going to do a little bit of an introduction in English, but then I'm going to be switching to Spanish for our Spanish-speaking audience in order to help them get the appropriate information and answer any questions that they may have. And so at this critical time, we need to work together to be sure that communication, language access, and other tools and resources for the communities during the COVID-19 pandemic provide equal access to information. So accurate and timely information in languages that are spoken by a diverse population is critical for the safety of not just the families themselves who may have limited English proficiency, but everyone in the community as well, due to the natural interaction that we're trying to currently avoid through social distancing. So it's key that we disseminate multilingual information related to not just the public health and preventative measures, but related to loan assistance for businesses and other resources available. So there is, for anyone who has acquaintances, neighbors, or friends who speak Spanish, there is, all the information is being timely translated and put on the Annapolis.gov website. So I encourage people to go over there. I'm going to switch to Spanish now. Buenas tardes. Gracias a todos por conectarse hoy. Yo soy el concejal Mark Rodríguez, aquí en la ciudad de Annapolis. Y este es un evento para platicar y compartir información sobre el estatus que está ofreciendo la ciudad, el condado, los servicios a nivel estatal y federal para apoyarlos a los residentes de nuestra comunidad en esta crisis, en esta pandemia del coronavirus o el COVID-19, ¿no? Entonces es muy importante que tengan acceso a la información verdadera y de manera eficaz. Nada más primero les queremos recordar una de las medidas preventivas. Yo voy a hablar un poquito de eso y de algunos de los apoyos y dónde buscar información. Luego mi amigo y colega Sergio Polanco va a ofrecer aún más información al ratito. Entonces estén atentos para eso, por favor. Entonces acuérdense de mantener, ahorita lo más importante es, como van incrementando los números de casos de COVID-19, es tomar las medidas preventivas para parar el contagio de este virus, ¿no? Que puede ser muy peligroso para ustedes y nuestros familiares. Entonces, acuérdense de las prácticas muy básicas, pero muy importantes. El lavarse las manos seguido, cada vez que entran y salen, cada vez que tocan superficies, por 20 segundos con jabón y con agua, es importantísimo. No se toquen los ojos, la nariz, la boca. Si tienen acceso a tapabocas, ya anteriormente nos estaban indicando que no debíamos de usar si no tenemos síntomas, pero ahora la recomendación es todo el mundo que salga a la calle, que se pongan un tapabocas, aunque tengan síntomas o no. Yo siempre llevo uno nuevo diario, ¿no? Si puedo. La distancia social es la práctica más importante, ¿no? Por lo menos 2 metros de distancia. Ya sé que es muy difícil, especialmente a veces vivimos en lugares más pequeños y así, pero traten de evitar la distancia. Es muy natural el querer saludarnos de abrazos, de besos, etcétera, pero hay que evitar todo eso, aún con nuestros seres queridos ahorita. Es muy importante en estas semanas. Si tienen síntomas, es importante que hable hay una línea de la ciudad del condado para la salud pública relacionado al COVID-19. Está en el sitio web, que es el annapolis.gov, pero también el teléfono, se los digo, si tienen síntomas, hablen, o cualquier pregunta relacionada, es el 410-222-7256. Se lo repito, la línea de salud al COVID-19 es el 410-222-7256. También el número de la Oficina de Manejo de Emergencias de la ciudad de Annapolis para no emergencias es el 410-260-2211. Otra vez, es el 410-260-2211. A nivel estatal y local también han puesto órdenes nuestros representantes de restringir nuestro movimiento. Eso quiere decir que solo hay que salir de casa para temas esenciales, ya sea el trabajo que sea esencial, por comida, por medicinas. Se puede salir a caminar y hacer ejercicio solo, pero mientras respetan la distancia social. Pero si no tienen que salir, no salgan y eviten estar en grupos de más de 10 personas. ¿Okay? Eso es importantísimo. Entonces, partidos de fútbol, etcétera, hay que limitarlos esos ahorita. Es muy importante. Esos son temas de salud. Y ahora entendemos que a nivel económico ha sido un trancazo muy fuerte, ¿no? Hemos perdido chambas, empleos, por órdenes de que los restaurantes y bares han cerrado. Ahora estamos muy limitados de ingresos y eso se complica muchísimo, el tener que tener una vivienda de ingreso. Entonces, si eres empleado y ya no tienes chamba por estas órdenes, es importante conocer si son elegibles o no para el tema de beneficio de desempleo que da el Estado. Es muy importante checar eso y los requisitos los pueden encontrar en nuestro sitio web, porque pueden potencialmente calificar para este beneficio de desempleo. Muchos no son elegibles o no califican para el desempleo del Estado por no tener la social o algo así. Entonces hay otros apoyos. Por ejemplo, el condado tiene un banco de despensa de alimentos, el Annapolis Food Bank, que es importantísimo, y ellos y otras agencias pueden coordinar a que recojan comida y despensas cada semana. El teléfono del banco de despensa del condado de Annapolis es el 410-923-4255. Se lo repito, es el 410-923-4255. ¿Okay? Nada más les recuerdo, y si son empresarios, si tienen negocios, acuérdense que hay apoyos a nivel estatal y federal para préstamos y otros apoyos financieros para que no corran a sus empleados, etcétera. Entonces, pues estamos a sus órdenes, todos vamos a sobresalir con esto, de esto, y por favor contáctenos con cualquier pregunta. Gracias. Thank you.
Thank you, Mark Rodriguez, for sharing that information and hitting home the importance also that we are reaching all populations. And aside from just being bilingual, we are multilingual, and we promise to get better at that. Next up will be Michael Drummond, and Michael Drummond is the Executive Director of Arundel Lodge. He'll be sharing information about mental health services and the importance of those communities that are experiencing additional stressors. Mr. Michael Drummond.
So it's a pleasure to be part of this presentation, because I think our power will come from all of us working together, and I think Arundel Lodge certainly wants to be a part of that. It's obvious, and I've spoken to many of our clinicians, that we're experiencing, all of us, increased depression and anxiety. One can understand why, because of, perhaps it's because of underlying health conditions, or the loss of a job and the economic insecurities from that, or from concern about our loved ones. This virus is impacting all of us, and we need to learn how to cope with that. I've got a slide deck that provides some information about coping strategies, and I think one of the things that I would really emphasize, several of them that I would emphasize, is obviously our lives have changed if we're staying at home and creating a daily structure for that time, or exercising, or continuing to do the things that are rewarding for us and meaningful, continuing to maintain a social life. I like to refer to it as distant socializing instead of social distancing, and to be kind to ourselves, and don't be afraid to ask for help, and certainly offer help to others who are in your neighborhood and who you can call or FaceTime with. Enjoy activities that you have enjoyed with others, like a book club, but just do it virtually now. I wanted to emphasize the information that and the contacts that are available through both the county and Arundel Lodge. The Anne Arundel County Health Department's main number, if you're looking for any of their services, is 410-222-7095. It's my understanding that if you leave a message there, they'll get that message to the right department and be able to respond to you. The Emergency Management Center for the Health Department is 410-222-0600, and they have a COVID-19 information number and help number. So if you have any questions about the disease, about symptoms you may be experiencing, about what you should do, that number is 410-222-7256. The Anne Arundel County Mental Health Agency Crisis Response Warm Line is 410-768-5522, and there are trained mental health professionals who can, on a 24/7 basis, be someone who you can talk to, and they can help provide, first of all, directly provide you some support and identify resources that could help you. Arundel Lodge is continuing to provide mental health and substance use disorder services, and people can call our main number, the 443-433-5900 number, and you can request an appointment. We're seeing our existing patients through telemedicine with video and audio secure conferencing, and we can also accept new patients and be able to do an assessment provide electronically documents for you to review about the clinic and its services and to consent, and also then to provide ongoing substance use and mental health treatment services. And I think it's very important. Don't be afraid to reach out to your friends and your neighbors if you're needing help. And certainly if you would like to, don't be afraid to seek professional help. One of the disturbing numbers is that we're seeing a rise year over year in terms of but in general, overdose deaths. And we know that people are struggling. Different communities are impacted more than others. And we want to be able to provide help now. And then when we're all able to get together again, provide help in the future. So pleasure to be here and pleasure to be part of the team and our community that's learning how to cope with this virus, and we will get to the other side. Thank you.
All right, thank you, Michael Drummond. Again, Executive Director of Arundel Lodge. Amazing resources and an opportunity to focus on some of what is, again, an added stressor to members of our communities in Annapolis, all wards, all corners of this city. It's not just relegated to one specific community. The other piece I want to add to that is our ongoing efforts with initiatives like No Harm, which focuses on opioid use and misuse, but breaking the stigma and also giving us an opportunity to focus on some of those health disparities within communities. I want to also add to our residents and viewers and listeners out there that we do have an amazing wealth of resources in terms of mental health help. In particular, there's if you go on Facebook and you look at members of a community like Octavia Brown, who's offering mental health advice online and an opportunity to connect with them. There are amazing assets in Anne Arundel County as well, which we will touch on. Next up in our ongoing community focus is someone who is a community advocate and has done tireless work and continues to do tireless work in our communities to deliver services to residents, both neighbors and also all across this city. And her name is Tony Strong Pratt. Tony, thank you for joining us today.
Sure, thank you, and good evening, everyone. I want to talk about the importance of food security during this time. There are food deserts when we aren't having a pandemic, but now that we have a pandemic, we're seeing. Can you hear me?
Yes, we can hear you.
We're seeing issues in our community with people not being able to access food and to access grocery stores, and the transportation isn't readily available like it was. But we have an initiative going on in lieu of the pandemic called Feed Anne Arundel, which is a group of organizations, acts. You have the Anne Arundel County Partnership for Youth and Family, and you have Monica Alberto, restaurant owner of Bread and Butter, have come together and formulated this initiative. As to date, we've fed over 5,150 people. We've raised $7,000 on Friday at a concert. Altogether for the whole campaign, we raised $70,000. And it still isn't enough. We still need funding. If you would like to donate to that initiative, you can email the Ripken Foundation with a focus on Feed Anne Arundel to give your donation. If you would like to volunteer, you can go to actiaf.org/volunteer. We have 25 restaurants signed up. The initiative is double fold. We're able to put restaurant owners back to work and bring workers back to get paid where they won't have to apply for unemployment. And we also get to feed a needed community, a resource that they so desperately need. There are also food giveaways. If you could put that resource up on the screen. On the screen, you will see all the food giveaways that are available in the county, which is much, much needed. I will ask that the city would put that on their website so you'll be able to access it if you need food. April 15th at the Whitmore Park in Annapolis, there will be Feed Anne Arundel with prepared meals, and also the food bank will be there giving out fresh produce and other different kind of items. This week, AACPS school will be closed for spring break, the 9th till the 13th, which is going to be much needed food resources needed for those days. So please, please govern yourself accordingly and make your way to one of the food banks. If there's a need that you can't get to, reach out to me and I'll try to put you with a right resource. Where are the needs in our community? One of the biggest needs that I've been hearing is we have access for mental health and substance use disorder. But I think what we're missing and what the community says we're missing, a lot of them, is a broad plan for alcohol addiction. In lieu of this COVID-19, our liquor stores are still open. We're seeing an increase in domestic abuse. We need a plan for these victims who are now being forced to be in quarantine in the house with their abusers. So I would ask that the mayor, the county executive, and the governor come up with more of a broader plan to address these issues, so that in lieu of the deaths that we're having as a result of COVID-19, we won't have that many deaths as a result of domestic abuse from alcoholism. So these are some of our issues for our community. I'm asking you to please, please, please be respectful of when you respond to people about the social distancing. That's our culture, to be in groups and to be together. And sometimes we just need to be reminded. So just understand that during this time, when a lot of us are on edge, a lot of us are really uncertain and fearful, just try to be pleasant with one another. We all want to do the right thing, but there is a way that you address people. And all I'm asking is that we use the respect that we would want to be used on us. Thank you.
Thank you so much, Tony. Again, that's Tony Strong Pratt. I want to punch home again the fact that we've worked tremendously in partnership with Feed Anne Arundel, which is an amazing effort that has happened throughout the city, delivering food along with Tony Strong Pratt. There's a long list of volunteers and community advocates and people who work for nonprofit organizations and restaurants that have been helping. Monica Alvarado is an example. Pastor Cheryl Menendez is consistently delivering services and providing food. We also have, along with Tony, her husband, William, who has tirelessly volunteered their efforts. I want to, of course, mention from the mayor's office, Adetola Ajayi, who shows up and helps plan and do a lot of events and a lot of work, not just around food delivery, but also around substance abuse, use, prevention. Again, I want to mention Kenny Starks. I want to mention some of our community folk, Dominic Scurry. I also want to mention Rita Dorsey and others, Dee Ward and others who are doing amazing work in our communities. The list goes on and on, so if I left you out of it, I'm sorry. Next up, I want to jump to a person who is an extremely important figure in the county's efforts to deliver services to communities, but also his work has been incredibly helpful with bridging the gap between the city's efforts and the county's efforts. And that's, that partnership is incredibly important. That's something that Mayor Buckley has focused on from day one. His name is Sergio Polanco, and we're happy to have him here. Sergio?
Thank you, Will. Thank you, everyone, of us to be part of this great opportunity. But also special thanks to Governor Buckley, our mayor, for this initiative and start identify the needs of our community. I'm going to say part in English and part in Spanish also, but it's very important for us to work as a team at this time. Everybody's learning for something that we are here right now. We are learning. This is a process that we never had before. And as a team, I'm sure we can get this done as a community. On behalf of the County Executive Stuart Pittman, all our commitment is community first, and this is the key for us. By connecting our communities with different resources, different services around, in order to develop the message, the opportunities that they have. Mi nombre es Sergio Polanco, soy el oficial de alcance multicultural para el condado de Orlando. Le quiero dar gracias al alcalde Kevin Buckley y a los organizadores de este evento por la oportunidad que nos dan de hacernos contar. Gracias también por la oportunidad que tenemos de reconocer en este momento tan difícil en el que estamos pasando cuáles son nuestras necesidades y cómo nosotros como líderes podemos ayudar a nuestras comunidades a encontrar, a cubrir esas necesidades. Es importante que nos unamos, solamente trabajando en equipo vamos a lograr hacer esto. Estamos pasando por un momento muy difícil, es algo que nunca habíamos experimentado, todos estamos aprendiendo de esto, todos, cada uno, agencias, organizaciones, un honor para todos nosotros representar organizaciones que trabajan para nuestra comunidad, y quiero agradecer también a toda esa gente que está trabajando desde casa. I want to thank to all these employers who work from home, and they don't work 8 hours, they work more than 10 hours a day just to make sure that our community has this. Quiero agradecer a nuestras comunidades, a la gente que está trabajando desde casa, que está tratando de hacer posible que todos estos recursos lleguen. I have some presentations around there, so I'd like to share with you. If whenever that person is ready to show the pictures I bring, I will be able to explain what we're doing. A través del condado estamos trabajando con muchos recursos que nos llegan a diario. Cada uno de ustedes posiblemente recibe varios de nuestros emails. Tenemos un boletín informativo semanal en el cual compartimos toda la información posible que llega. We have a bilingual newsletter, English and Spanish also, that every week we got all the information twice a day. Next, please. And all this is just to connect the communities. Esto lo hacemos para poder conectar a nuestras comunidades. Tenemos un programa de televisión, se llama Bienvenidos. We have a TV show. It's a bilingual TV show, Bienvenidos. Ahí tenemos a mi amigo Carlos Camino, es el educador del Departamento de Salud, que hicimos un programa exclusivamente sobre preguntas y respuestas del COVID-19. Ustedes lo pueden encontrar en nuestro website del condado. Next, please. Y pueden encontrar mucha información de la que tenemos. Next, please. Y en base a eso estamos trabajando. El website del condado del Departamento de Salud, el website del Departamento de Salud en la sección en español también tiene mucha información para ustedes. La línea de información del COVID-19 es el 410-222-7256. El Departamento de Salud del condado está trabajando muy fuerte para poder proveernos mucha información a diario, para poder tener números exactos que nos pueden dar a nosotros una mejor visión de cómo están pasando las cosas en nuestro condado. Next, please. Y en base a eso seguimos trabajando fuerte para ustedes. Desde el website del condado, ustedes van a narandolcounty.org y ahí van a encontrar la barrita española al lado derecho. Ahí tenemos información del beneficio de desempleo, información del censo, programas que tiene el Departamento de Salud trabajando. Next, please. Y en base a eso seguimos trabajando para poder traerles a ustedes mucha información. Servicios sociales, tiene la oficina tiene mucha información para ustedes. Los bancos de comida, estamos trabajando con todas nuestras comunidades desde el Departamento de Educación local, con todos los bancos de comida alrededor, para poderles llevar a nuestra comunidad estas necesidades. Next, please. Y es triste cuando sabemos que los recursos en algún momento se nos están agotando, pero lo más importante para nosotros es saber que estamos trabajando en equipo. The most important thing for us is keep working as a team. That way we can help our communities at this very, very, very hard times that we have. Next, please. So I would like to say thanks everyone to be part of this, and like to answer any questions that people there having for everybody, every one of us. Once again, thank you, Mayor Berkeley, for this opportunity, and together we'll do better. Gracias.
Thank you so much, Sergio. We really appreciate the opportunity to be able to communicate with all of our residents, and remembering that COVID-19, based on health disparities.
You need to unmute your mic.
Oh, okay. Thank you. Thank you, Sergio. Can you all hear me now? Thank you, Sergio. I want to, we really appreciate your focus on communities that we know data is showing that the COVID-19 crisis disproportionately, affects marginalized communities and, affects communities that have any barriers to information. And it also directly correlates with health disparities that are pre-existing, which we know is a much deeper issue. And I encourage all of those that are listening and viewing to share your comments. And if you have any additional information that might help us connect residents to services, it's greatly appreciated. As I mentioned earlier, our mayor has, from day one, focused a lot of his energy on creating opportunities for staff in the mayor's office to reach communities that need to be reached. And heretofore haven't really specifically had a direct pipeline to city services and resources. And so we want to commend our alderpersons, all of our alderpersons from all wards who have focused a lot of energy on moving in that direction. And we thank the mayor for his leadership. What we want to do now is both wrap up a little bit this part of the presentational part, but move into our question and answers. And I want to encourage all of our panelists to feel free to attempt to answer these questions. I want to start off with a question really quickly that says, can you talk about what residents should do if they have symptoms but do not have a regular provider to get a referral for a COVID test? And is there anyone on our panel who can answer that question?
Mike Drummond touched on it.
Mike Drummond, I know you touched on it. Would you care to?
Like one resource you have is to reach out to the health department. If you have medical assistance or some other type of insurance, you can go through either your private insurance or medical assistance to find a provider whom you can meet with. For example, I know that the community clinics at Anne Arundel Medical Center are providing telehealth services as well. So either find a provider or contact the health department if you're experiencing symptoms of the COVID-19.
Okay, thank you so much, Mr. Drummond.
Algo que quisiera agregar a esto, que es la pregunta en español, que traduciendo la pregunta en español rapidito que hacen, si alguna persona sale afectada con este virus, ¿cuáles son los pasos a seguir o a dónde puede recurrir para para asistencia? Recuerde que el COVID-19 o COVID-19, la línea está abierta, el 410-222-7256. Lo único que tiene que hacer es marcar ese teléfono, pedir a alguien en español si usted no habla inglés y preguntar por una enfermera del Departamento de Salud. Ahí le van a asistir. No tiene que preocuparse si no tiene papeles, si no tiene su estatus legal. Eso no importa. Lo importante es su salud. Gracias.
Gracias, Sergio. So the next question is from Monica Alvarado, and her question is, given the quarantine, I understand the number of calls to help with abuse or trafficking victims have dropped. How is the city addressing this? That the number of calls for help have dropped. And one of the headlines that we did see is that there's an increase in domestic violence. Does anyone care to answer that question?
I'll share quickly what I do for residents in my ward. Immediately we get together, we reach out to the property management, we try to get at least in a 4-hour turnaround period, measures in place with the property management, the resident and the police department, so that the incident will not happen again, whether that be changing the locks, banning the individual who may have committed a domestic act from the property, or just if it needs to be done, immediately arresting them so that the incidents won't take it to the next level. And I've been doing that throughout the pandemic and before, just to ensure that domestic abuse is something that continues within our communities.
Thank you so much, Alderman Gay. On that same...
If I can just add something to that, that is one of the things we're seeing in the clients that we're serving, where people are staying at home with someone who they are in an abusive relationship with. And I think the YWCA resources is another place where you can reach out to that you had up on the screen a second ago, at least to get advice and ideas about within your resources, networks, how you might be able to address that situation.
Thank you, Michael Drummond.
I would add that the city first responders are answering every call. The call numbers are down for some kind of things because people have decided they don't want to address them. You can do your own reports for minor incidents, but any kind of emergency, call that number straight away and we will be there immediately. Thank you.
And to add to that, if you are not able to, because you can sometimes domestic situations are so violent where the individual just may not be able to get to help at all. If you are a neighbor and you witness something like that, or if something just doesn't seem right, or it just is extra off, reach out to maybe a non-emergency number, what you see, so that the authorities can get involved. Because it happens with children too during this time. That go through abuse from parents at times, and we just want to monitor all of those things.
Okay, thank you so much, Alderman Gay. Sergio, would you like to? We're going to put that hotline number up again. Can you translate for those who are Spanish?
La línea para abuso doméstico es 24/7, las 24 horas y violencia. Esta línea es el 1-800-799-7233. Apúntelo. Si usted sabe, conoce. Si usted ve algo, dígalo. No se quede con los brazos cruzados, porque nos va a ayudar a salvarle la vida a alguien. 1-800-799-7233. Disponible las 24 horas del día.
Thank you so much.
YMCA, el 410-222-6800. 410-222-800. Esas son las líneas para poder ayudarnos.
Thank you so much, Sergio. So Alderman Rodriguez has a question that we received in Espanol, and he will translate and deal with that question. Alderman Rodriguez?
Oh, yeah. So, la pregunta de Milton González sobre los apoyos para los negocios y cuándo va a regresar a la normalidad esta situación a nivel económico, porque Milton tiene una peluquería ahí en Eastport. Y la verdad, la respuesta a cuándo se va a volver todo normal no se sabe, obviamente, estas semanas y meses en lo que se va a llegar a hacer algo de normal la situación, tanto de salud como de económica. Obviamente se requiere un balance entre las políticas de salud pública con las económicas, pues la necesidad de vivienda. Y por eso es muy importante que se ponga en contacto con nuestra oficina de desarrollo económico, porque ahí están compartiendo y les pueden ayudar a guiar con todos los recursos para el apoyo a los negocios pequeños y medianos a nivel local, estatal y federal. El teléfono de nuestra oficina de desarrollo económico es el 410-260-2211. Otra vez se lo repito, es el 410-260-2211. Y ahí les van a poder compartir información sobre, por ejemplo, la Agencia Federal de Pequeños Negocios, la Small Business Administration, tiene ciertos apoyos ahorita, tanto un programa que se llama el Payroll Protection Program, donde puedes aplicar para un préstamo hasta 250% de tu gasto mensual de sueldos para no despedir a sus empleados y poder seguir la nómina y apoyando a su gente y seguir operando. También hay otros apoyos a nivel estatal del comercio de Maryland. Vayan al website commerce.maryland.gov, que es commerce.maryland.gov, y el teléfono es el 767-6300. Entonces, hay apoyos para los negocios, para empresarios en estos tiempos y para guiarlos, hablen a la Oficina de Desarrollo Económico, por favor.
Algo que quisiera agregar, Mark, en esta pregunta del señor Milton también, es de que a nuestro alrededor hay organizaciones sin fines de lucro que están apoyando a la comunidad y creo que ya todos tienen idea del centro de ayuda, por ejemplo, que aunque ellos no están abiertos, oficina original, todo el equipo está trabajando desde casa. Si usted tiene alguna duda, si no sabe algún número, llame a los números del centro de ayuda y ellos ahí se comunican. Si no lo tienen ellos, llaman a Mark, llaman a Sergio, llaman a cualquiera para averiguarlo, pero usted siempre va a tener una respuesta para sus preguntas.
Thank you so much. I want to add from Centro de Ayuda some information about for small businesses, but also important contact information. And that telephone number is 410-260-2211. Again, 410-260-2211. We'll be sure to share that information. And I want to also add at the conclusion of today's town hall that all of this information will live on the city's website, annapolis.gov. I want to also thank our communications director and our city's PIO, Mitchell Stevenson, who has helped bridge the gap on a lot of this information. And it's not an easy thing to do. As I said, we're all learning, everyone from Michael Drummond to Alderman Dewan Gay, to Sergio Polanco, to Alderman Rodriguez, to Mayor Buckley, to Tony Strong Pratt. We're all, hopefully learning to work more in cahoots and more in partnership. So I commend you all and thank you all again. One of the questions I have is for Mayor Buckley, because I know both being in leadership, also being the mayor, and also being a very sociable person who loves connecting with people and sharing information. How have you been navigating this? And, on a personal level, what's this been like as a resident of this city yourself and as mayor?
So I hope that some good things can come out of this. So I know that lots of people are walking more places, riding, going out with their kids to more places, discovering parks in the city and the county that we didn't even know that we had. I know that lots of people have learned how to work from home and not have to drive and burn fossil fuels to go to their jobs in Baltimore or DC. On the other side of this, and there will be another side of this, I hope that we can come out better human beings, kinder to one another. This isn't just America's problem, this is the whole world's problem. And it really put everything in perspective for me. The things that have divided us, you've heard me say this, the religion, could divide us, the religion, the politics, the nationalism, individualism, all those things, they're not worth anything, because now if we don't come together and fix this, then, all is lost, and we will fix it. So I say, there is an upside to it, but we've still got a long way to go. And we have to remember, there's a lot of anxiety out there, and people are tense and people are worried for their families. And so we have to be kind to one another. We have to understand if someone seems tense or angry, there's a reason behind it. I'm sure most people aren't like that naturally, but just be tolerant of one another. I know my kids are being tolerant of me. My wife said she'll survive COVID probably, but she can't survive me working from home. So, there's a lot of things we're going to learn from this, but I've definitely dug deep, and I'm going to be a different person on the other end.
Okay, thank you so much, Mayor. So Alderman Gay, one of the things we have seen, and particularly in your ward, because of comments and things that people have observed, again, all out of concern for our health, is the gathering. So can you remind us again about physical and social distancing, and just touch on what some of the dynamics are in some communities in making that shift to the distancing piece?
Yeah, again, just touching on it, I think the first priority is educating our neighbors and continue to educate one another on what's reoccurring daily. as we've mentioned in the beginning of this, the numbers change drastically overnight sometimes. So it's important to keep people updated on that. And then it's important to let people know how to not continue to spread the virus using social and continuing to wash your hands, not going into large crowds. In our neighborhoods in particular, when you're leaving out of apartment buildings, not making sure not to gather in public places, because that is how you easily, can spread the virus. And what's even more concerning, as we mentioned in the beginning, are the numbers that come back when we look at what the state of Maryland released today. And you're seeing that African Americans are the most infected, and they also have the highest death rate. So just continuing to message and let people know that it's a serious virus. And you may not see the symptoms right away. You may not think you have it, or you may not think your friends who has it, but it can be passed that way. So it's just important that we just continue to stress social distancing, wearing your mask when you're outside. If you can't afford to purchase a mask, there are ways to make masks out of bandanas, out of socks. And I'm sure the city's page will continue to update with those resources. I'll put them on my Facebook page and continue to share those ways, just so that we can, make sure that we're using the resources that we have to continue to fight this.
Thank you so much, Alderman Gay. Sergio, can you provide a translation on that, because it's equally as important in other communities that we understand social and physical distancing. Thank you.
Básicamente es bien importante mantener la distancia social, lo que hablaba Alderman Dajuan Gay. So basically, lo que necesitamos es mantenernos alejados de la gente, 1,80 m como mínimo, que es lo que nos piden. Si usted sale, trate de no estar cerca de otras personas cuando está en la tienda, cuando va a hacer algún mandado, trate de no acercarse, no permita que la gente se acerque a usted. Y lo más importante, recuerde, una pregunta que hicieron al principio para Mark, ¿cuánto tiempo esto va a durar? Entre más caso hagamos a quedarnos adentro, un día más encerrados en casa es un día menos que tenemos que tomar en cuenta en la lista. Así que es muy importante eso, que lo tomemos en cuenta. Y rápidamente, quiero tocar un tema. Yo sé que el tiempo se va muy rápido. I'd like to talk a little bit about one of the main questions a lot of people is making right now, and I find that is how we can help people who they are right now struggling, having a lot of problems for landlords, for their apartments, for their homes. Y es bien importante para nosotros, lo estamos tomando en cuenta. El proceso no es fácil, necesitamos la ayuda. We need to work as a team with different organizations, different leaders in the community to provide help to those who they are not afraid to pay rent, to those who they live day by day, to those who they are so worried about, no benefits around for them, and they have to pay rent, they don't have enough income.
Okay.
So, estamos trabajando en eso a nivel de comunidades. Sabemos de que todos juntos vamos a lograrlo, pero usted, por favor, quédese en casa.
Okay, thank you very much. I'm pushing along because we have a hard stop. So I have a question on here from Jim King. The city is proposing to not pay city workers money that is guaranteed to its workers during these times. It is claiming a budget shortfall, but the money that's supposedly short won't come in until next year. I have our city manager who is going to answer that question for you, and his name is David Gerald.
Good afternoon. So this answer will be very fast because we have 2 minutes left. So we're facing a large budget deficit next year in fiscal year 21. So we have open negotiations with the labor unions, but this measure that's discussed in this question will apply to all city employees, both union and non-union. So there is a cost of living adjustment that is scheduled to take place on July 1st. So what we're asking all of our employees is to push that back until January 1st of next year. So we wouldn't be taking any money away. What we would be asking to defer is the additional pay, the additional cost of living increase that's scheduled for July 1st.
Thank you so much. That was much more succinct than I would have ever been able to answer. I want to end this by going to our mayor, Gavin Buckley, and I want to thank you all for your attendance today. Thank you all who are listening. Mayor Buckley?
So I want to say thank you to everyone. This is tough times and we all have to dig deep. But I especially want to thank all of the volunteers in this city, or the faith-based community, all the people that have just shown kindness and are asking where to volunteer, where to drop food. That is what makes our community a beautiful place to live. The more of that we do during this time, the easier it'll be for us to get through, and we will get through. And we love you all. Thank you.
Thank you. Take care, Annapolis.